This episode of Profiles in Risk is sponsored by Zywave. Insurers, brokers, and agencies are facing escalating risk and rising complexity. Only Zywave delivers a performance multiplier, equipping you with the tools to get risk right, unlock efficiency, and scale at new speeds. Find out more at 𝗧𝗵𝗶𝘀.com.
Hello and welcome to Profiles in Risk. This is your host, Tony Cañas. Today I have with me Danny Aronson, CEO and co-founder at 𝗬𝗃𝗃, and Ann Boger, COO at 𝗬𝗃𝗃. So first of all, thank you for joining me today. How's it going?
Thanks for having us. It's going great. Ann.
Morning. Happy to be here.
Fantastic. And I'm actually on the road in Prague this week. And my girlfriend is defending her dissertation in France next week.
Wow.
And we were in Egypt vacation last week, but I'm working from Prague and working from France this week, and then heading back to the States for the couple of Vegas conferences coming up.
Digital nomads for the win.
It's been a crazy year. it's been a really crazy year, but yeah, it's all good. So according to LinkedIn, you guys are both kind of New York, New Jersey area, right?
Don't say New Jersey. Be respectful, Tony.
So you're kind of both New York area.
We're both in
No.
You're both. I thought one of you was New York. Okay, so you're both New York area. Cool. So late September, I'm guessing beautiful fall in New York, not yet cold.
Warm and rainy.
Warm and rainy, because so warm means like 60?
75.
That is super warm and rainy.
Yeah.
We're in the tropics, man. Brooklyn has become part of the tropics now.
Yes.
Do you get snow at some point in
It's like Thailand weather over here without the beaches. It's just warm and rainy and gray.
Yes.
All right.
I am literally climbing on my roof later today to make sure that the water is moving down.
Yeah, man. Nobody moves to New York because of the weather. Let's put it
yes,
that way. It has many things to offer, and Brooklyn's awesome, but the weather is certainly not one of them. It's like the shittiest weather on the planet. So, we take the good with the bad.
At least you have a decent airport now, because for a long time you didn't. The new LaGuardia is actually really, really nice.
That's totally true. That is very true. Yeah.
Very, very good to see that New York has a good airport now. It's still how there's no train to get from LaGuardia to Manhattan. That makes zero sense to me.
No, you can take the A, right? You can take the A to JFK. I think
it's hard. I was actually just with Chris Luis from Scout InsurTech last night, and he was like, okay, I'm gonna do this by train, wish me luck. He left like 2 hours to do it because
it's like buses and multiple connections kind of thing. It makes no sense. All right. Yes. So we always give the guests the chance to give the elevator pitch. So what is 𝗬𝗃𝗃?
It's a great question, Tony. Thanks for asking it. 𝗬𝗃𝗃 is a health benefit that provides full spectrum hearing health for the workforce. What we mean by that is, just like you have dental and just like you have vision, which seems super standard, right? Less than 11% of employees have any sort of hearing benefit. This is kind of important. The ability to hear, the ability to communicate, not just in work, but with your loved ones, with your family, balance, all the things that hearing does and the ear does are critically important for our overall health. But because of historical factors, and I'm sure we'll kind of dive into it, it has been overlooked, and it's a major gap in healthcare. As I said, less than 11% of employees have access to any type of hearing help. It's typically not covered by insurance. And it is the most common sensory issue in the US. There's 50 million people who have some sort of hearing issue. Notice that I don't say that they need hearing aids, but they have some sort of hearing issue. So 𝗬𝗃𝗃 was designed to be able to provide a accessible and affordable platform to allow employers to add hearing health as a standard employee benefit, where we focus on kind of what we define as the 4 pillars of hearing health, which is prevention, all forms of hearing loss, hearing disorders, and balance issues. And that's a big change from what has traditionally been viewed as hearing quote unquote benefits, which is basically a coupon for a hearing aid. So we are kind of spearheading this movement, which is moving away from here's a 20% coupon on a hearing aid, and that's hearing benefits, to here is a holistic, full spectrum hearing health platform that really focuses, as I said, on prevention, on all forms of hearing loss, hearing disorders and balance, and really kind of giving the ear. I keep feeling like I'm the voice of the ear. It's like, this is important. You need your hearing. It makes no sense to have one a hearing test when you're 8 years old in middle school, and the next one when you're 75. But that's reality. I mean, think about it, Tony. When was the last time you had your hearing checked? Be honest.
Do they do it for like your driver's license?
No.
Oh.
So
unless you're a taxi driver.
So no idea.
But this is like every pitch we do, and Ann and I pitch HR and benefits people, 7 times a day, every single day. That's the first thing we ask them. How many hours a day do you use headphones? The average, Tony, is between 5 to 8 hours every single day, right? And then I say, when was the last time you had your hearing checked? Don't know, never, middle school. I'm like, that's the pitch. That's the pitch. So we are really kind of working to give the ear the importance it needs and the respect it deserves, by giving it a benefit, and getting people to check their hearing every year and be proactive about it. And that's kind of that's the mission. And I'm glad to say that we are seeing a lot of success in it, and a lot of growth and interest from it. And I'm very optimistic that in the next 3 to 5 years, or 5 years from now, dental, vision, hearing will be a completely standard package of benefits for every employee in the United States.
All right. Right. Is it covered by Medicare?
It is not covered by Medicare. It is not covered by Medicaid. What is covered, I think, in plans B and C, is $800 every 3 years towards a hearing aid. The average cost of a hearing aid is $6,000. So $800 doesn't really go that far. Typically, it's not covered by major medical unless you have a physical issue in the ear. But as I said, nothing around prevention is covered, which is the most critical thing. Nothing around mild to moderate hearing loss. So hearing loss is on a scale, right? It starts from what we call mild hearing loss, then it moves to moderate hearing loss, then it moves to severe, and then it moves to profound. Typically, people who need hearing aids are people who have moderate to severe hearing loss. That's a very small fraction of people who have any type of hearing issue. So everybody who has mild to moderate, completely, there's nothing. If you have tinnitus, which is ringing in the ears, which is very common, about 25% of the workforce have it. There's nothing for you. There's nothing for prevention. There's nothing for balance. So your balance mechanism in your body, part of it is in your ears. Even if you have mild to moderate hearing loss, you are 5 times more likely to have a slip and fall. Now, when we say that to employers, here's a way to reduce the risk of slip and falls, which are extremely expensive in the workplace, by getting your people tested once a year. It takes 10 minutes. Everything is done online. The entire platform is a virtual platform. Then it becomes very interesting. So I think I'll take a step back here and kind of say we are the largest online network of audiologists in the US, with over 300 audiologists in all 50 states. The platform is a telehealth platform. One of the reasons we started it as a telehealth platform back in 2020, when we started the company, 60% of counties in the US don't have any audiology clinic anywhere. There's like literally nowhere to go to. There's less than 5,000 clinics in the US. That's including hospitals, and that type of thing. So, and there's about 14,000 audiologists in the country. That's about 1 for every 100,000 people. Like where Ann and I live in New York, in the Bronx, there's 2. There's 2, literally. So by creating a telehealth platform, you're allowing people to be able to see and get audiological care in a way that's very efficient, very effective. But I think even more than that, the mission we're on is really getting people to understand that the ability to hear is the ability to communicate. Like we do these pitches, right? So I will do this. I will close my video and I'll continue talking and I'll say, we have a great, we can keep having this conversation, right? But if I do this, Tony.
Which I do usually about once an episode.
But that's every time I go on one of these calls and somebody's on mute, I'm saying you're demonstrating the importance of what we're talking about right now. So I think that's kind of the mission. It has a strong educational component to it. But I think we've designed a solution with Tuned, which employers and carriers and brokers are finding very useful and intriguing and new. And yeah, it's been a ride.
Okay.
So I've joined Tuned about 7 months ago now, 6 or 7 months. So I am newer to hearing health. And I'm really excited about the timing right now for a couple of reasons. One of them has to do with technology. So as Danny mentioned, we're a telehealth platform and you can have clinical grade screenings done with whatever headphones you have at home. So you can have really good data on your hearing, right? Which it's not an on-off switch. It's all these different decibels, right? When I was a kid, my grandfather could hear me, but not my dad because of where he'd had his hearing loss as a veteran, as someone who shot a lot of guns, right? Like he was a hunter. It impacts what part of his hearing he loses, right? It's not all the same. So what's really interesting to me is this moment in time when your AirPods could potentially be tuned, if you'll excuse the pun, to fix your hearing, to address your specific hearing gaps. And that's Apple is getting into this business because the old school $6,000 hearing aid is not the future, right? What is the future is having much more accessible technology where you need is the audiologist and the screening data to affect how you're using your hearing. And most hearing benefits that employers are offering their staff are going to be replaced by these processes, but they're still expensive. There's still data. There's still things we need to learn. So by having this telehealth platform at this moment in time, you can stay current instead of sort of these older hearing aids, which are modernizing as we go and are important for a small fraction of the population. But if you have a hole in your hearing, there's a range that you can't hear very well. What do? You turn up the volume for everything. Now you're blasting all the other frequencies. So you took a small narrow gap in your hearing and you made it much worse. And so people have this sort of hearing death spiral based on their own behavior, that if you just had the audiologist and that screening up front and you knew how to tweak it just right using technology, you could avoid a lot of that hearing loss. So that's what Danny means when he's talking about prevention. It's that the behaviors we adopt, the way we work, what kind of work we do, impacts what our hearing health is going to look like long term. And so
100%.
that really excited me when I first met Danny to learn more about that, because we're in a moment right now where the health technology and the hearing technology are coming together, are converging, and Tuned is right in the middle of that.
Okay.
100%.
So it's not just a matter of our healthcare system in the US being the mess that our healthcare system in the US is. It's just that the technology wasn't there before.
Well,
It's a convergence. It's a convergence of these things. I think, yeah, if you would have told me 10 years ago, so I've been in the hearing health business for about 12, 15 years now. It's an interesting business from an insurance perspective, and it's like a weird story, kind of like a business school story about why oligopolies really suck for everybody except for the oligopoly. So for the past 40 years, the hearing aid industry has been dominated by 5 manufacturers. 4 of them are foreign companies. One is an American company based in Minnesota, and they own They basically own hearing health, and they're manufacturers. I always say, imagine if cardiovascular was owned by stent manufacturers.
So there was no pressure to improve the technology or.
There's pressure. There's the only pressure is around unit sales of hearing aids, which is whenever you talk to people about hearing, they're like immediately hearing aid, grandma and grandpa's hearing aids, right? So these are 5 companies who have owned hearing aids for about 40 years now. And here are the results. Hearing aids in 1980 a pair of hearing aids cost about 1% of the annual income of a family. Now it's 4%. So that's a 4x. It's become more expensive. Devices are on average between 4,500 at the minimum to $6,000, $7,000, $8,000 for a pair, which is just ridiculously, absurdly expensive. It is a virtually integrated market in the sense that the manufacturers own 61% of all of the independent clinics. So when you go to an audiology clinic, you're actually going into a manufacturer's store where there is a group of people, audiologists, who work there, whose job it is to sell you a hearing aid because those are the unit economics of what they do. That's what keeps the lights on. So if you go in there with mild hearing loss, they'll be like, and I've had this said to me, like I have moderate hearing loss and tinnitus, and I went through this process, and what I got was, well, your hearing loss is not that bad that you need a hearing aid, come back in a couple of years. And I was like, there's like 10 different things that you could do to help me right now. So we have an industry which is vertically integrated, owned by manufacturers. Again, think about cardiovascular owned by stent manufacturers, or by GLP-1 manufacturers for gut health. Obviously, it sounds absurd, right? You would never. This is hearing health. This is what it looks like. So you're going into a clinic. The clinic is owned by a manufacturer, and the unit economics is to sell you a hearing aid. Same with the so-called hearing benefits. All but one of the companies, or like 4 or 5 companies that do this in the US market today, all but one of them is owned by the manufacturers. So Tony, what do you think they are looking for? They're looking for the sale of hearing aids. And it's incredibly ineffective. Less than 15% of people in the US who would benefit from some sort of hearing intervention ever get one. So it's a complete market failure, except for these 5 companies who rake in billions every year, and they're very happy. So Tune comes in and basically says, we're not a manufacturer. We're not here to sell you anything. We are a hearing health provider. We want you to get screened every year, and you can do it super easy. It takes 10 minutes. You do it online. Then we want you to talk to a doctor of audiology. We don't presume that you'll know what to do with this information by yourself. And you'll review the results with the doctor of audiology, who is a hearing specialist. Our head of audiology, Dr. 𝗲𝗄𝗃, has designed the entire process. So we're very audiology driven. And then we offer probably the widest range of solutions for people, from earplugs, because we don't want you to get hearing loss, all the way through FDA approved over-the-counter hearing aids, tinnitus apps, balance specialists, all the way up to and including hearing aids if you need them. And to Anne's point, what we're seeing, and this is what I started saying, if you would have told me 10 years ago that Apple would go and would create the AirPods as an FDA-approved over-the-counter hearing aid, I would say you were nuts. Because nobody wanted to get near it because it was perceived as only an old people's problem and an old people's device. This is standard now. This is like everybody has this. It costs $250. You cannot explain to me or to anybody in this business why this costs $250 and a pair of hearing aids costs $7,000. And the reason you can't explain it to me is because there is no reason. It's all markups. It's all a very fat, self-satisfied industry that has had a monopoly or an oligopoly for decades and is now looking at a massive, massive change because, again, during those 40 years, the MO was either, if there's competition, we either buy them out, we either bully them out, or we sue them. Sounds familiar in healthcare or in tech in general? They can't sue Apple. They're not going to buy out Meta or Luxottica or any of these companies. So once you have these huge, electronic device manufacturers coming into the playground, just looking at the numbers, the entire sales of the 5 hearing aid companies combined are about 10% of Apple's AirPods business. That's the relationship.
And it's that by number of units or by like
By revenue.
Holy crap! So by number of units, it's
by number of units. It's
well, I mean, Tony, and that goes right to the point that very few people actually need a prescription level hearing aid.
Yeah.
Right? I mean, either maybe you have some folks who are born with a severe or profound hearing loss and may have a very different trajectory. I have family members who are deaf with a capital D, right, and who live in a community of ASL and BSL speaking, communities. But for those who lose their hearing over time, a very small percentage need a prescription, especially as the over-the-counter devices like Apple, like what you can buy at Costco, continue to go up. But the education and the care navigation is what's been missing. And that's where our sort of audiology first approach is really profoundly different. And I think also where we're really understanding that hearing issues start much younger than we think we do. It's just like any other, sort of chronic healthcare problem in the United States. We're really, really good at selling complex medical treatments for disease. We spend much less investment upstream in what it takes to take care of people. And what this means is that if you are a working professional in your 40s or in your 50s, you have tinnitus and you have mild hearing loss in one ear, or you have other kinds of just chronic things, you get dizzy a lot, it just wears you down. You're just less effective in the workplace, right? You are communicating less often, speaking up less in meetings, getting more depressed, feeling more isolated, being less productive on your day-to-day. And it is an invisible cost. And it happens in a wide variety of industries. My sister is, God bless her, a high school science teacher.
God bless her. In the biggest school in Brooklyn, right?
In the largest high school in the United States, which is Brooklyn Technological. Brooklyn Tech has about 7,000 teenagers in a single building. Okay. Just imagine walking into that building as classes are changing and all 7,000 kids and teachers are running from one room to the next, and they're all teenagers and they all speak at top volume, right? No wonder she has chronic tinnitus.
Sorry, go ahead.
And I think there's something genetic going on because my father died young, but all of his siblings have hearing aids. So I know that there's a hearing loss risk in my family, it seems, right? Like all 7. Yeah. My sister's got nothing.
Yeah. So So we were talking to we have really close relationships with Colonial Life and with Unum and USI and NFP and a lot of other kind of brokers and carriers. But one of the things that we're doing is, for example, pitching, public sector education. And we're running the numbers to them and we're showing them teachers are 40% more likely to have hearing loss than somebody. They literally work in an airport. The amount of noise is around 85 to 90 dB. Being constantly in that type of environment, you are literally working in a factory. That's one of the things we try to explain to people. People keep thinking, "Oh, only if I work in construction, or if I work in a factory, or if I work in transportation, those are super noisy professions. And obviously I need hearing protection, stuff like that." Well, first of all, guess what? Most of these people don't have anything. And the second is a lot more professions are very, very noisy. Teachers, dentists. Do you know that dentists have hearing loss in their left ear in the specific frequency of the drill They are twice as likely as any other profession to have hearing loss and tinnitus. They have zero hearing benefits, zero, nothing. People who work in sales, people who use headphones all the time. The idea that your ears were designed to have a little speaker stuck into your ear canal for 8, 9, 10 hours every single day. And you're like, and I keep saying, and you don't think that that's going to affect your hearing. I find it fascinating. I'm like, seriously, like, what do you think is going to happen? So we now have research that shows, this is CDC, WHO, multiple research papers, that we have what we call now the headphone generation. The headphone generation are 6 out of 10 people between the ages of 12 to 35 in the US. Think about that. Over half of people between the ages of 12 to 35 were at risk of severe noise-induced hearing loss. They are going to need hearing aids by the time they're in their 40s, not when in their 70s. Think about your colleagues, your friends, their kids. How many kids do you know who sit with headphones and play whatever it is on PlayStation for 10 hours a day with headphones? That does not make your ears better. It makes them worse. So we need to get in front of this. And I think, again, with Tune's approach, which is we are not trying to sell you any type of device or any type of solution. We want you to get screened. We want you to get a consultation. And if there's anything we can do to help in terms of devices, we have the full capability to do so. And that's a very, very, very different proposition than what has traditionally been out there.
So is this a brand new type of benefit that just didn't exist before?
Yep. Category creation for the win. As I always say, one of the wonderful things about being a new company is that you're new and exciting. And one of the worst things about being a new company is that you're new and exciting and it's new. Especially in insurance, especially in benefits, where the idea of it just takes a long time for people to wrap their heads around and get used to it and kind of hear it over and over again. And, again, as I said, Anna and I pitch HR and benefits people and decision makers all the time. And you can see how hard it is. Like there's a million point solutions. Everybody is vying for the same dollars. Major medical just keeps going up and up and up and up and up. And you're a benefits person and you need to make this decision. Am I doing this? Am I doing this? Am I doing that? I think one of the things, again, that we do very well, Tuned is extremely affordable, very inclusive in terms of what it offers, and it's a foundational benefit. It should be part of dental, vision, and hearing, what we call whole head health. This idea of whole head health, again, just from a even if you want to look at it from an ROI perspective, there's research from Johns Hopkins that shows that people with untreated hearing loss cost employers around $2,500 a year more than somebody without it. It affects their productivity, it affects their communication, it affects everything. So it's a foundational benefit. Tuned is about, I would say, a quarter of the cost of vision and much less than dental.
Yep. And I think there's some really interesting things, Tony, as we think about your audience and just the broader insurance community. I think there's a lot of opportunity for some really interesting crossovers, because if you think about workers' compensation, you think about workplace risks, think about the expense of employees' overall well-being and productivity. I think there's it's a silent, if you'll excuse then yet another awful pun. I seem to be full of puns today, but it's a silent cost driver for risks across the board. That's one of the things when I met Danny and he was telling me some of his story of, Danny kind of jumped right into the mission, but some of his background is that he's classically trained musician, he's a veteran, he's been a sound engineer and ran a sound engineering studio. So he knows a tremendous amount about this industry, is obviously, and it's personally affected him and people in his life, right? Musicians often struggle also with hearing issues because of the amount of time they spend around loud instruments and in music halls and the like. So there's just this incredible amount of opportunity here, and risk control and risk mitigation that something like a real clinical screening that you do from home with your own headphones can produce. And so that's one of the reasons, as someone who's been in the alternative benefits and insurance risk management landscape for like 20 years, when we sat down and had coffee because a friend introduced us, I was like, oh, this is something new and different and interesting. And in a lot of ways has been a long time coming.
I'm always curious on the origin story. So then you come from the sound side. How did you realize that a new insurance offering was the way to start fixing this mess?
Oh, I went I went down many rabbit holes before I got to before we kind of conceived of Tune. But as I mentioned, I am a classically trained composer. That's kind of I was supposed to be a great avant-garde composer. That was the plan. Got married, had a kid, found out shockingly that there's not a lot of money in avant-garde classical music. Needed to make a living, kind of deviated towards sound design, built a big and ran a big sound design studio. And I'm also a veteran, so I have hearing loss and tinnitus, which is the number one and number two hearing health issues for veterans in general. And I started noticing significant issues with my hearing around my late 30s, early 40s, and kind of got involved in the hearing world. And I was like, what is this? Why is it so expensive? Why isn't it covered by insurance? Like, what is going on? So our first company, my co-founder 𝗨𝗏𝗀𝗀 and I started, was one of the first over-the-counter hearing aid companies back in 2013 or 2014. So we were in manufacturing, and I spent a lot of time in Southeast Asia, which is why I know, by the way, how much it costs to make a hearing aid, which is around $150, Tony, and sold for 6,000. Just so you understand the numbers we're talking about here. That's what it costs, and at scale, it's less than that. So, and I've been to the factories, so and we did that for a long time, for about 6, 7 years. Amazing experience. Did a lot of direct consumer sales and stuff like that. But then around 2020, it kind of, there was been pandemic, and it kind of hit us that we are trying to affect large scale change in a fundamental aspect of American healthcare. And we looked at other ways that people get the type of care that we want them to get. Most people, 71% of people, have dental. They go because they get dental through their employer. In the US, healthcare flows through your employer. We might not like it. We might say that a lot of critique, and you can say whatever you want about it, but that's reality. So 71% of people have dental, 63% of people have vision, less than 11% of people have hearing. And if they have any type of hearing benefit, here's a coupon for a hearing aid, which is absurd. So wanting to affect change at scale meant we need to create something that an employer can plug into their benefits stack, which is super affordable, super easy, and will give the employer the ability to say, this is important. So it's now dental, vision, and hearing. And I want you to get your hearing checked every single year. And when we started the company back in 2020, I went and raised money, and I pitched this to a group of ENT angels. And after I finished pitching them, their response was, what you're trying to do is the holy grail of audiology. It will never happen. Nobody will pay you a cent to do this, but we wish you the best of luck. So I can say 4 years later, with 120,000 members, serving about 160 companies, working, as I said, very closely with Colonial Life and Unum and Emeritus and USI and NFP and Marsh and Gallagher and so on and so forth, I think they stand corrected. And I think there is an appetite and an understanding that that hearing is just a major gap in care, and that Tuned offers a very affordable and viable way of plugging that gap. It does. It's typically after these pitches, the question isn't so much why should you, it's like, why shouldn't you?
Yeah, it makes sense. Yeah, it absolutely makes sense. I'm blown away that you can get a real hearing test online with your own equipment at home.
It's called a hearing screening. We do two even. We do one which is called digits and noise. You hear numbers, and there's like this white noise, annoying white noise in the background, and then you need to click in the numbers that you hear. And we do another one, which is kind of more traditional, what we call pure tone tests, where we're trying to figure out what is the minimum volume you can hear certain frequencies. And we also have a very comprehensive, clinically validated questionnaire. And again, we are focusing on what we call full spectrum hearing health. It's not just about hearing loss. Hearing loss is one aspect of hearing health. But tinnitus is very, very, very prevalent. If you know anybody with tinnitus, or if anybody who's going to listen to this, and I'm sure people know people with tinnitus, they know how difficult it is. And typically you go to an ENT or you go to a standard audiologist and they'll say, suck it up, there's nothing we can do. Or you need a $6,000 hearing aid. That's not going to help. So we look at tinnitus, we look at balance issues. Do you get dizzy when you get off from a chair, when you get up from your chair, or do you have vertigo, stuff like that? That is critically important. People have this kind of fatalistic sense about their hearing. They assume that they're going to go, they're going to lose their hearing as they age. They assume there's nothing to do about tinnitus. They assume there's nothing to do about, balance or all of that is wrong. There's a lot that we can do, and the people who know how to do this are doctors of audiology. And again, to Anne's point, this convergence of technological advancement, both in terms of the devices and the solutions, and in terms of the way that we can deliver care, I think that why this is the right time for this to, and why we're seeing it take off in such a meaningful way.
What is missing for mass adoption? Like it's growing quickly, but like, is it just a matter of exposure?
I think for me, one of the things that I've learned, being in kind of very intense in the insurance industry over the past couple of years, and we really focus on working with carriers and brokers and stuff like that, is the adoption cycles are slow. I think it took mental health about a decade, 10 to 15 years to become the standard that it is now. I remember if in 2010, if you would go to your employer and say, I expect you to pay for my mental health, they would be like, no. Now it's a standard. GLP-1. I mean, that was not something that I saw 5 years ago, 6 years ago, 7 years ago. Women's health is something that was not considered a standard in healthcare. And it took years and years and years of education to get there. And I think we're at that inflection point with hearing health. It's just telling that story over and over and over again, and seeing adoption till we get to that inflection point where it becomes just a standard employee benefit, whole head health. You get dental, vision, hearing. Let's go. It's part of that. Anne, what do you think?
Yeah, the only other thing I would add is that I think one of the things Danny mentioned earlier is that there's so many different options out there. If you're an employee benefits administrator or HR person, or if you're a broker on that side of the house, it's like, how do you keep track of all the things? So one of the things we've been really partnering with people on, and I'm really excited to keep working on, is how we make it super simple and super easy for employers of different size companies, and also for employees to just sort of have it, feel like a default, or blend it into something that I've got a lot of different issues I want to take care of in my population. I have a lot of risk factors. How do I help? How does hearing compared to mental health, compared to a fertility, family planning, like how, right? And it doesn't have to be that way. So we see tech platforms, PEOs, sort of bundled programs coming together where it doesn't have to be a big decision. Actually, tuned is probably the least expensive item on any of that list, right? It's just an
Mhm.
easy thing to add in, and we can make it super experience. The experience can be very simple and and that will increase the ability for access to happen naturally. So we're really excited to partner with people who are building those kinds of employee benefit centers of excellence or enrollment platforms where it can be just a check the box to add this to your employees, especially for companies that are a little bit on the smaller side and don't necessarily have their own system at home, you know. So I think as we're growing the story, as more people are becoming aware that it doesn't have to be a fatalistic, you know, come back when you're deaf kind of a situation.
Hmm.
Now we just need to make it super easy, and it's going to be through those technology platforms and through those existing sales channels that it just becomes the next you know, obvious thing. So we're really excited to educate also people who work in this industry who don't want to say, oh, I have this fancy new hearing benefit, but don't ask me any questions because I don't actually know anything about hearing health, right? That is itself its own challenge. So there's all, as you know, there are all these steps along the adoption process, and a lot of people we need to bring into the fold who need to become more comfortable understanding where the science and technology of hearing health is going.
All
But
right.
again, I think when you have companies, again, and I'm going back to what Apple is doing, we're putting hearing health front and center
Yeah.
of their most desirable and most sold device. When they're doing a 1 minute long ad with 1 billion views about the importance of hearing, this is again something that a decade ago we could only hope for. So it is becoming much more mainstream, and there's an understand. The average age of people who go through our program is 42, because people are beginning to understand that this is something that they need to take care of. And no, you're not destined to lose your hearing. There's a lot that you can do to save it. Oh, and I can do this from home, and it's super easy. Yeah, it is. So I think hearing health is really poised to go down the route of mental health and other kind of things that were once, I think, perceived as outside the realm of standard care. And you know, one of my pet peeves, sorry again, a pun, and you and I are on puns today. One of my pet peeves is 51% of American employees have access to pet insurance. Tony, there are literally more dogs and cats insured in this country than people who have access to hearing health. That doesn't make sense. I mean, it's obvious. It's you don't need to be a doctor of audiology to understand that it's just upside down, and we're here to fix that.
Yeah.
All right, fantastic. I love to see new coverages, and I love to see insurance being used as a way to the insurance mechanisms and used as a way to radically change an industry that is so important. So yeah, fantastic stuff. Love hearing from you guys.
Thank you.
Been waiting for 20 minutes to say that. What's
I know
that?
we're wrapping up. We've been talking. We could talk forever about this, but one thing I wanted to say, you know, as you were mentioning that sort of, I got into insurance originally because I believe in social safety nets and the power of the many to take care of the few, because you never know who's going to be hit by a catastrophe of any kind, whether we're talking lightning striking your house or, you know, something else. And the truth is that right now in our workforce, we have 4 or 5 generations working at the same time. And a huge chunk of us are in our midlife where we are the sandwich generation. We have kids at home and we've got elderly parents we're taking care of who may or may not still be working themselves. And the ability to take care of a community is so important. And that's why our newest plan that's coming out, you can actually add your parents. I just think it's like, because we're not just thinking about how does insurance typically organize things, we're thinking about how do we get care to the most people we can.
That is fantastic.
That's because it started because every pitch that Ann and I do typically within a minute, it's like from the people we're talking to, it's like my dad, my mom, my uncle, my this, my that. It's a nightmare. It's so expensive. We don't know where to go. We don't know what to do. Da, 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 da. And we're like, this is absurd. It's like here. So we've added that ability, which I think is critically important again, as an employee benefit.
Fantastic. Thank you both for your time today.
Thanks for
Thank
having
you.
me.
My pleasure.
See you in ITC.